Welcome to the Banished Cancer Podcast. I'm Rachel, and today we're exploring a topic that lies at the heart of caregiving: empathy. More than technical skills or specialized knowledge, empathy is what builds trust, makes care feel personal, and helps both caregivers and care recipients feel connected. Joining me is James, our cancer wellness educator. James, thanks for being here.
Thanks, Rachel. Empathy really is the foundation of caregiving. It's the ability to understand and share the feelings of those you care for. When caregivers practice empathy, they communicate better, reduce stress for patients, and create a sense of safety.
Let's start with the basics. What does empathy mean in caregiving?
Empathy has three parts. First, effective empathy, feeling what others feel. Second, cognitive empathy, understanding their thoughts. And third, behavioral empathy, acting with kindness. You show empathy by listening, offering comfort, and accepting people without judgment. It's more than noticing someone is upset. It's connecting with their emotions and showing them they're not alone.
People often confuse empathy with sympathy. How are they different?
Sympathy acknowledges suffering but stays detached. Empathy goes deeper. It shares in another's feelings and creates a stronger bond. Sympathy often leads to offering condolences, but empathy fosters emotional validation. Care recipients say empathy feels warmer and more genuine. In caregiving, empathy builds trust and comfort, making a real difference in someone's life.
What impact does empathy have on care recipients?
It builds trust and safety. When caregivers show empathy, people feel secure and understood. They're more likely to share their worries and needs, which lowers stress and even reduces medical mistakes. Real-life examples include using a calm voice to comfort someone with dementia, listening closely to ease anxiety, or patiently explaining things to reduce confusion. These small acts of empathy create big feelings of safety and hope.
And beyond trust, empathy improves outcomes too, right?
Absolutely. Empathy leads to better health outcomes and higher satisfaction. When care recipients feel understood, they follow care plans more closely, experience less stress, and report higher satisfaction. Caregivers who respect cultural preferences, sit at eye level, validate emotions before giving advice, or involve people in decisions all show empathy. Studies confirm that higher empathy leads to better service, stronger relationships, and improved mental health.
But empathy isn't just for patients. How does it benefit caregivers themselves?
Empathy makes caregiving more rewarding. It builds stronger emotional connections, improves communication, boosts morale, and increases patient safety. It also fosters collaboration among teams. Celebrating small wins together lifts spirits and strengthens bonds. Empathy transforms routine tasks into meaningful moments.
And it helps prevent burnout too.
Exactly. Caregiving can be tough. Long hours, emotional challenges, and stress. Empathy helps caregivers handle these pressures. Studies show higher empathy links to lower emotional exhaustion and depersonalization. Empathy creates a sense of purpose and connection, protecting caregivers' well-being while making a real difference for others.
For caregivers listening today, how can they grow empathy in daily care?
Start with practical strategies. Listen with your heart and ears. Respect each person's life story. Share emotions together. See things from their perspective. And take kind actions based on what you learn. Empathy training programs, mindfulness, and journaling can help strengthen these skills. Over time, empathy becomes a natural part of caregiving.
But empathy can be challenging. What should caregivers do when they feel tired or overwhelmed?
Practice mindfulness to stay present. Connect with support groups to share experiences. Journal to process emotions. And take breaks to recharge. Remember, empathy grows with practice. Each day offers new opportunities to connect and strengthen bonds.
What's the bottom line for our listeners today?
Empathy shapes every moment in caregiving. It helps people feel safe, valued, and understood. It also protects caregivers from burnout and brings meaning to their work. Higher empathy leads to better care, stronger connections, and healthier outcomes. As one quote says, empathy is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. Every act of empathy makes a difference.
James, thank you for breaking this down. And thank you to our listeners for joining us. This has been the Banished Cancer Podcast. If today's conversation helped, share it with someone who might benefit. The more we understand, the stronger we become.